Okay, we're just making this short video to explain a bit more about the petition we want to lodge with the Australian Senate, because we actually want foods that lower your cholesterol, that have phytosterols added to them, taken off the supermarket shelves. Products like this, like this, like this, and I hope when we finish this and we go home, nobody wants to take them with them. So fire away with any questions that you have.
Glenn, these are products we see every day on the supermarket shelves, and in some cases doctors are recommending that their patients take these products. Why do you want them banned?
Doctors in Australia are advised by the Heart Foundation and the Society of Cardiologists that their patients eat 2 to 3 grams of the phytosterols or 3 teaspoons of the margarine, for example, a day. If you lived in Britain, their doctors are advised by their authorities to tell their patients never to eat this stuff. There's a big difference between the two countries. And the reason why the difference exists is in England, the authorities don't accept that just because something lowers cholesterol, that it reduces the risk of heart attack and strokes or is good for you. Now the dumb thing is, the Heart Foundation actually states that there is no evidence that it reduces heart attack or stroke. And there's been no long-term trials done to see whether it could have adverse medical outcomes over time. But they still tell you to eat it. Now the fact is, we've done our homework. And for people who are taking statins, the only conclusion you can draw from the experiments on mice and evidence from actual real people is that it's likely to increase the risk of heart attack and stroke and reduce the benefit of the statin that you're taking. Doesn't make sense. Just doesn't make sense.
Look, Glenn, you're obviously very passionate about health issues confronting the boomer generation, but you're not a scientist and you're not a medical professional. So, what evidence do you have to support all these claims that you're making about phytosterol-enriched foods?
They're not my claims. I'm just the messenger. It's the claims of the medical researchers, not me. The only difference between me and members of the public is that I've been doing this for about 12 years and I've learned all the medical terminology and can understand what these researchers are saying. General public can't. So if they go to the internet and look it up, they're just getting basically websites that generally have a product to sell to you. We have no product to sell as such. It'd be nice if we did, but we don't. Now, the issue is simply this. The scientists are really straight A logical people, and they publish it in scientific journals read by straight A logical people. They are crap salesmen. And it takes forever for the message to get through to the medical profession. Forever. The USA dietary authorities just last year removed their advice of to eat no more than 300 milligrams of cholesterol a day. Why? Because the advice was a waste of space. Their reasons clearly laid out. If you don't eat it, your body makes it, it makes no difference.
But my understanding that these foods that you're referring to and that you showed us at the start of this video, they've been approved by Food Standards Australia.
They've been approved for the therapeutic claim that they make on them. When nobody out of their goodness of their heart goes to Food Standards and says, I want to make this product because I really want to make Australians healthier. They go there for profit. And for profit, if they need a therapeutic claim, they've got to get approval. So they went there with the therapeutic claim that it reduces cholesterol, which it does. And that claim they could prove and back up. So it was granted. But it's not the point. Does it reduce the risk of heart attack and stroke? People have this thing that they think your arteries get clogged up with fat until they get skinnier and skinnier and skinnier and you have a heart attack, or narrower and narrower. That's just not true. But that'll give you pain and shortness of breath and things like that. But that's not what causes a heart attack. They fix that with surgery. You can have a stent or a bypass. What causes a heart attack is when the fat, which they call plaque and cholesterols and everything else in that artery, rupture and leak blood through inflammation, make a clot. That clot travels, gets stuck in a smaller artery in your heart or in your brain, and you have a stroke and heart attack. That's one of the problems with these phytosterols. The cholesterols that are in your plaque from eating too much cholesterol or your body not working properly, then they have phytosterols in their plaque. And that destabilises the plaque. And it's unstable plaque, an inflammatory plaque that causes heart attacks. And that's one of the things that phytosterols do. But another thing is your microvascular structure, your very, very tiny capillaries that deliver the oxygens and the nutrients and everything else to your cells. You can't see those except in the back of your eye. And when they put people on a course of phytosterols and then look at the back of their eye, it had damage done to the microvascular structure in the back of their retina. Now, you can't say this is a fact, but you've got to say, would that be restricted to just your eye? Or will it be all of your microvascular structure? Now, because they're scientists and they're logical, they say, look, we can't say what the outcome of this will be. All we can say is that the damage we're seeing done is equivalent to that of long-term smokers and people who have metabolic syndrome. So, is smoking good for us? Nope. Does that damage to our eyes, and why wouldn't it do the same damage smoking's doing? Especially when it provides no benefit. I think probably the best example of providing no benefit is a trial called the Improve It trial. And that was for people who developed a drug that blocks cholesterol, which is what happens when you eat the phytosterols. And the idea being the lower your cholesterol gets, the less chance you have, your bad cholesterol, the less chance of you having a heart attack or a stroke. So they got people who were on statin drugs, and they added this drug called ezetimibe to it. And Bob's your uncle, their cholesterol levels went down a further 28%. This must be good. They kept the trial going for 7 and a bit years, and there was no difference in all-cause mortality between the people who were having the ezetimibe added and the people who didn't. Heart attack and stroke were improved by 2%, but not death from any cause. A heart attack and stroke were improved by 2%. But then you go and look at what other scientists have done with that drug on mice at human dosage rates and comparing it to phytosterols with these foods we're talking about at human dosage rates and see what happens to the two mice. In practice, the ezetimibe drug reduced the plaque level by twice as much as the phytosterol enhanced product reduced the plaque level. But that's not the point. The phytosterols destabilise the plaque as well. Much higher inflammation, more macrophages, more oxidation, all the things that causes plaque to cause a heart attack. So if you go back to what the drug did in humans, that was no improvement in death if you're already on a statin, and a marginal near imperceptible improvement on heart attack and stroke, what do you think it would be like if instead of taking that drug, you're eating these margarines and supplements and yogurts and milk? The chances are you'd have a worse result than taking the statin alone.
Well, I think I mentioned to you that there's general practitioners in Australia who are recommending this product to their patients.
Yeah.
What would a general practitioner in Britain, for example, be saying to his patients with high cholesterol?
Don't eat this.
You're emphatic about
You
that?
can look it up on our site and you can actually go to that organisation's doctor's recommendations. And their organisation in England is set up a bit like the Reserve Bank. There's no relying on donations like the Heart Foundation. It's people are placed in to run it for a period of years that can't be fired, and the government funds it. And if they don't have the people and they have to do research on some new product or something, they go out and they grab experts from the field out of the profession and bring them in just to work on that. It's not the way it works here. Right? So I believe their advice. But it's even silly. Another document put together by the Heart Foundation, I think the Diabetic Foundation, it goes through it all, and it basically says there's not enough evidence for us to make any recommendation on phytosterol supplementation. Yet they still put the bloody tick on it, and they still say to eat 2 to 3 grams a day for it. That's on their own side.
It begs the question that the people that, or the businesses that produce these products, are they aware of what you're saying? Why are they producing these products?
They may or may not be aware of what I'm saying. But why are they producing these products? That's easy. Food Standards Association said that, I won't name the company, said, they offered this to make the health of Australians better. Well, my answer to that is then, why are they selling ice cream full of sugar and fat? Well, if they want to make Australians healthy, they should take their ice cream off the market.
So your position is, Glenn, that these foods should be banned altogether?
No. One of the things that does happen, and this is what doctors have told me, they said, I get some patients who just refuse to take drugs. They're against drugs. Like, you got some parents who are against vaccination, God knows why, but they are. Right? And he said, I then tell those people to eat phytosterols. Now, my answer to them should be, hey, a lot of our best drugs are actually extracts from plant. All our pain medication is mostly opiates, from opium. Some of our best chemotherapy drugs that have been around for about 30 years are extracts from various tree barks and stuff like that. Just because it comes from a plant doesn't mean it's not a drug. It depends on the quantity of it that you're taking and how toxic it is when you take it in those quantities. So as far as I'm concerned, they should tell their patient, this stuff is just a drug in margarine instead of in a capsule. You can get it in capsules if you want to go and buy a supplement, but
are there any warnings on the labelling of these products?
Look, there are warnings, and when the authorities were first granted, the warnings were, they've reduced in size over the years actually. The warnings were, where are they on this one? Can't see it quickly, that's pretty typical. On this one, not suitable as a complete milk food for children under the age of 2 years, for children under the age of 5, pregnant or lactating women and people taking cholesterol medication. That's good, because the other products don't normally say that. Doctor's advice should be sought before using Heart Active due to special dietary needs. But some of them, like this one's pretty new to the market, I haven't seen it before. You can tell I'm a boomer, I've got to put it out here even with my reading glasses on to read it. So small. This product may not be suitable for children under the age of 5 years and pregnant or lactating women, but I do know that there are children of 5 years of age who'll go to the fridge and get their spread and put it on their toast with some jam or whatever, and I'm pretty damn sure they're not going to read the fine print on the bottom of this.
So, look, as a member of the public, an Australian citizen, what practically can I do to do this? What are you proposing that we
One
do?
of the problems that, a petition's only been out for a little while, but one of the issues is people are taking note of it and telling me, and if they were buying the product, they're not buying it anymore. That's not the issue. We're not saying the product should not be available. We're saying it should only be available on prescription, or at least as a pharmacy drug, where you've got to talk to the pharmacists behind the counter, not in front of it. So the issue is really, this is not advice as to whether you should eat it or not. The petition to the Senate is, go back to Food Standards Australia, go back to the Therapeutic Goods Association, look at our research, do their research, with the question to them, can they show you that this product reduces heart attack and stroke and is safe long term? If they can't, it shouldn't be available to the public. Now, to get that happening, we have to have an officially formed petition which works with the Senate, which needs an email and a name on it, and it's got to say the right words at the start, and we have to give it to the right senator, and so on and so forth. But the impact of it is, if we're successful, people who don't see this video, or people who self-medicate without the knowledge of knowing what they could possibly be doing to their own bodies, don't have access to the food unless it's through a pharmacist or a doctor. And that's the way it should be, because this is nothing more than a drug placed into food without a proper trial deciding whether it's any good, whether it works, or if it's harmful to people. If this were a normal drug, somebody invented this molecule, that's the process it would have to go through, and it would take years. The first part of this going to Food Standards Australia, the evidence that it reduced cholesterol was done in Unilever's labs in the Netherlands on rats. Because it's absorption in your intestine, basically rats are a bad animal to use because they have a very high pH in their intestine compared to humans. But the results are right. And they only fed them on it for 8 weeks, not the whole of their life or half their life or whatever. Then the other thing that they did was they did it through 3 generations, fed them Phytosterols just to check that no birth defects were caused after 3 generations. That was what Food Standards Australia got, and New Zealand, to approve the product. What homework they did after that, I don't know. But it's not enough. And we know from work done on humans now by going back and them asking questions, by giving them a placebo and seeing what happens to the back of their eyes, and by measuring plaque, that the long-term health consequences could be an absolute disaster. And we don't want something that doesn't provide any benefit that can be measured to be on the market to find out 30 years from now it's killing people, and you can't undo what's been done.
And how do we go about signing this petition, Glenn?
Just go to boomerspetition.com.au, follow the bouncing ball, add your name and add your email address.
And you've referred to some research and documentation. Is that accessible?
All the research is there, and all the links to it are there. A lot of the research that goes into the scientific journals you have to pay for. So in some cases where the article is free, you can read the whole article. In other cases, just the abstract. Any doctor or medical profession can click it and read the whole article if they've got a subscription through a uni or a medical organisation. And honestly, if they read all those research articles and come to a different conclusion than we have at Boomers Health, then for heaven's sakes get in touch with us. But I just can't believe it would be possible that they wouldn't agree if they read it instead of just relying on what the authorities here have been telling them.
So, I just want to get this straight. You're saying that if we are consuming these products, I might or might not get a heart attack in future?
I'm saying that there is absolutely no evidence that consuming these products will reduce your risk of heart attack or stroke, and that's the purpose of lowering your cholesterol. Unlike drugs that have been tested, statins, the ones that have passed the tests, basically, with regards to health and safety, they are absolutely proven to reduce your risk of heart attack and stroke. And modifying your diet can have exactly the same benefit if you're capable of doing it. And we'd never recommend that, if somebody's been prescribed a drug to reduce cholesterol, or with the purpose of reducing the risk of heart attack and stroke, to stop taking it. What we would do is say, try changing your diet and go back and get your tests done again, and go back and get your tests done again. And this has happened to a few of our friends, and eventually the doctor says to them, you don't need to take this statin anymore. Some people that won't happen to, some it will. But you should never stop taking those drugs at work. And then, because if you become paranoid about it and you are taking that drug, you should never add this food to it. That's our opinion. Unfortunately, that's your doctor's opinion in most cases right now, because that's what they are told to do by our authorities. If they were in the UK, they'd be telling you exactly the opposite. We agree with the UK.
So what happens when we sign the petition? What are you hoping to achieve out of the petition?
I think it will help us get publicity. It's a pretty simple request to the Senate, and we hope that they act on that request. Go back to the standards organisations and ask for the evidence. Is it safe? Does it reduce heart attack and stroke? If those questions can't be answered, then they should instruct those organisations to look, hey, they're off the list. Leave it in the fridge at the chemist shop where you've got to ask the pharmacist, or get a prescription from the doctor.